Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
The preterm birth rate in Uganda is estimated at 14 per 1,000 live births. Preterm babies are prone to serious illness or death during the neonatal period. Those who survive are at increased risk of lifelong disability and poor quality of life. One of the complications is permanent blindness caused by a preventable condition, retinopathy of prematurity.
Especially if there is good care in the NICU, good oxygen management in the NICU, and all babies who are born preterm should be screened at least 1 month after birth. And babies who are screened early and the disease is identified early, they can receive treatment either by receiving what we call the anti-VEGF. Commonly in Uganda we are using Avastin, but unfortunately for babies who present very late, maybe after 2 months, after 3 months, we have seen many of them come with irreversible blindness from what we call retina detachment.
Some babies with ROP have mild cases and get better without treatment, but some babies need treatment to protect their vision and prevent blindness. This treatment is only being introduced in Uganda by Stop Infant Blindness in Africa, an initiative that has seen health workers get skilled in key areas like diagnosis and treatment.
Last year we helped deliver some equipment to St. Francis Zambia Hospital, and the local team at the hospital has done a great job in reducing the amount of retina problems in babies that can cause blindness, and they've implemented the use of oxygen blenders and screening for retinopathy of prematurity, which can cause blindness. And so we're here to provide more support for them and hope to encourage them to continue improving care.
St. Francis Zambia Hospital in Uganda is the first hospital that benefited from SIBA. Dr. Victoria Nachibuka, a neonatologist at the facility, explains what they have benefited from the partnership.
Last time we were here, they had brought us the equipment that we're using for screening and some equipment we can use for prevention. So they're able to train us concerning prevention of retinopathy of prematurity. They gave us some equipment which are called blenders, that is the mixing of oxygen, and also they are able to teach our ophthalmologists and the nurses on how to identify babies that may need ROP screening.
However, there is a need to increase staffing levels, especially for key specialists like ophthalmologists.
Currently in Uganda, we are only 42 ophthalmologists. 18 are in Kampala, and we have very few in the other parts of the country. But we have seen that with the introduction of cameras, we can actually train other cadres in the healthcare to do the images for these babies, to do the screening in the different neonatal units, and they can only send babies who need treatment. I think that can help go around the challenge of human resource. Access to treatment is still a challenge because the treatment we use is not provided by government. It has actually been a big challenge because babies have been screened, but some still cannot afford treatment. Even after screening, you find that a baby cannot afford treatment, and we have actually had cases who have gotten blind.
The Commissioner Maternal and Child Health at the Ministry of Health, Dr. Jessica Nsungwa, says they have developed a policy on the use of oxygen as they try to enable healthcare workers provide the needed critical care.
We need to move away from guidelines we've been using. We've been using Kenya guidelines, we've been using American Academy guidelines. We need to develop our own. So what we started in the Ministry of Health, we set up a small team because last year we were reviewing our essential medicine list. And one of the things which came out, we have prioritized actually these medicines on the essential medicine list now. The list has just been concluded. Actually, it was approved like 2 months ago. We still need to have more information on when to give some of these medications. We have also revised the structure for government. So we have more of these specialists who are going to come on. So I think now the timing is ripe for us to be able to bring in some of these commodities massively. So we have also now established a unit for the eyes. For the first time, we have an assistant commissioner who is just going to focus on the issue of service delivery for eye care. So we have an assistant commissioner for ophthalmology. So with all the expertise for the newborn people and expertise in the eye care, I think we are going to make a very big milestone.
There are no studies that have been conducted in Uganda on the extent of this problem, but research done at Zambia Hospital showed that 1 of every 5 preterm babies suffers total blindness due to retinopathy of prematurity. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities